Imagine if every child was breastfed within the first hour of birth, given only breast milk for their first 6 months of life, and continued to be breastfed up to the age of 2 years. About 800,000 children's lives would be saved every year, and this would be as a result of the benefits of breastfeeding that range from provision of disease preventive effects to its being cost-effective. World Vision Uganda, Kitgum Cluster, through the East Africa Maternal Newborn and Child Health Project, in conjunction with Kitgum District Local Government, facilitated the Baby-Friendly Hospital Initiative in 23 health facilities in Kitgum District.
Kitgum District has been working hand in hand very closely with the support from World Vision, and they have trained a number of staffs from the health facilities on how to manage BFHIs in their facilities.
We were trained in BFHI how to improve our service deliveries. After the training, we came back for implementation of what we learned.
In the first trimester, we do history taking, vital observation, and then we do pre-counseling tests before we remove our blood for HIV/AIDS, and then syphilis test, and then HB level examination, and then we do the vital observations, that is the BP of the mother, the weight. We have to educate them on nutrition, how they should take balanced diet. These mothers, when we health educate them, we tell them to come with their partners. And then in the second trimester, she comes now when she is 24 to 28 weeks. We assess for the possible problem she has. And then in the third trimester, she comes when she is now from 36 weeks. We do abdominal palpation. We also check for anemia. We do also vital observation as well, abdominal palpation. We check on the lie of the baby, if the fetus is lying well, the movement, and then the presentation. During labor, the mother is welcome. We receive her antenatal card. We check for her code, if she has been tested, and then we retest her again. After delivery of the head, we examine it to check if the cord is tight around the neck, and then you wipe the baby's face very fast, and then you deliver the baby onto the mother's abdomen. Then that skin to skin contact, we encourage the mother to handle her baby with 2 hands. We support the mother to initiate the baby on the breast milk within that first 1 hour of birth.
Even at C-section, a mother initiates breastfeeding immediately. The baby is born. After clearing the airway and seeing that the baby is safe, the baby is put onto the mother's breast.
We continue to monitor them on exclusive breastfeeding, of which we have to encourage them to breastfeed exclusively for 6 months, and we help them to complement their babies. Male involvement is encouraged, especially when these mothers are delivering. Even their next of kin, they are encouraged to come and assist them when they are in labor.
This is a 3 days old baby. The first baby to the mother. Though we always teach them from antenatal about attachment, when they deliver again, we teach them the same thing.
With the initiative, we've been able to now create a team that is well informed about breastfeeding, and we even have a breastfeeding corner that has been very useful for both the mothers, the working mothers, and also the mothers who have babies.
Before discharge from the health facility, a mother is given a fully filled mother passport and child health card.
mothers after deliveries, they are given vitamin D, 200,000 international units.
Before we discharge the mother, we first immunize the baby with the BCG, and then polio 0 is also given to the mother, to the baby I mean. Then we help educate them on how to breastfeed, initiate breastfeeding after every 2 hours when she goes back home, and then care for the cord. We encourage mothers to join parent support group where they belong so that they continue with the care of the baby at home and themselves.
My wife, the name is called Achani Masulet. Those who are working in the hospitals, they told us that the umbilical cords, which is there, we should take care so that there's nothing like any germs or anything to get contaminated with the umbilical cords. From the hospitals, when we came back home, I also advised her to cover the baby properly to avoid some of the colds and contaminated air. On top of that one, we also encourage the wives we are having in the groups to breastfeed their babies.
One group can you get a better chill, or pony, get a better rio, or pony chill, be a teen, keep pony, get a mirror guacalatin. I think I made a big guacalatin, pack away down.
For quality improvement in BFHI, health workers hold regular CMEs and monthly appraisals.
We have safe appraisals. We greet monthly as staffs to see if we are improving or where there is a gap and where there is where there are challenges.
As a means of accountability towards attaining the baby-friendly status, the 23 health facilities in Kitgum district each signed a commitment to work towards achievement of baby-friendly spaces, and each facility has pinned this commitment alongside the translated BFHI policy as a reminder to what they have to do. More than 44% of the district health workers are knowledgeable on BFHI. There is existence of community and health facility linkages through community structures like VHTs and PSGs in each village. Improved male involvement, especially during ANC visits. 90% of mothers discharged from the health facility have a mother passport, and their babies have a field child health card. More comprehensive health education and documentation is provided at all the health facilities. The main objective of BFHI is to promote, protect, and support breastfeeding. With World Vision Uganda's support and continued commitment and support by the Kitgum District Health Team, BFHI will go a long way in giving hope to the mothers in Kitgum. Hope and assurance that they will be able to get good maternal and child health services delivered to them, their babies, and to their families on a whole.